courtesy announcement that this meeting is now broadcast live on YouTube and our web portal. Good afternoon, Sarah.
Hi, good afternoon.
Mike, sounds good. Thank you. Good afternoon, Judge Geffen.
Hello there.
Your audio sounds good. Thank you. Good afternoon, Rebekah.
Hi, good afternoon.
Sounds fine. Thanks very much.
Thank you.
And Chairperson Ellenberg, your clerk today is Dave, by the way. I'm just doing mic checks.
Thank you so much, Des. I appreciate it. And appreciate you, Dave, if you're there already.
I am. Thank you very much.
Yeah, we just need President Wasserman to show up and we will be ready to go. It's still 3 minutes early. He likes
The
to be
vice
on
chairperson today.
Vice chairperson.
Good afternoon, Dan.
Good afternoon.
Good afternoon, Mike.
Good afternoon.
Audio sounds great. Thanks.
Thank you.
And to the several of you who just joined us, if anyone would like to check their audio, please go ahead and chime in. Looks like Gabby, if you're there and want to check your microphone.
Good afternoon.
Thank you. Go ahead, Michelle.
Good afternoon. This is Captain Aspen.
Captain Asman, if you're in the sheriff's conference room, that might be why you have an echo. So you'll have to mute the output from your own laptop.
Hi there, testing. How does that sound?
That's fixed. Thank you.
Recording in progress.
There's my vice chair. President Wasserman, how are you doing?
Hello there, Vice President. You sound like I did yesterday.
Oh, yeah. Got a lot of that going on here.
For me, it was the decongestant made all the difference in the world. I don't know what helps you, but good luck.
Thank you. Mostly sleep. Hard to come by.
All right. Take
All
it
right,
away.
it is 1:30.
Yes.
And I'm going to call to order this meeting of the Public Safety and Justice Committee on Thursday, December 9th. Let's begin with a roll call. Dave, please.
Good afternoon, Vice Chairperson Wasserman
Here.
and Chairperson Ellenberg.
I'm here as well.
Thank you. You have a quorum.
Fantastic. Do we have speakers interested in making public comment today? This is the portion of the agenda reserved for members of the public wishing to comment on any item not on today's agenda, but within the purview of the committee.
We currently have three speakers, Madam Chair.
All right, let's give that just another second or two and see if we stop at 3.
It looks like
Already?
we're staying steady at 3.
All right, let's do 3 minutes each, please.
All right. The first speaker is Julia Mangione. I've unmuted you. Please accept the unmute. You'll have 3 minutes to speak. The timer will start when you begin speaking.
Hello, everyone. My name is Julia Mangione. I'm a member of Showing Up for Racial Justice, SURGE, at Sacred Heart and the Care First Coalition. I live in District 4. I'm calling today to ask that you honor the findings of the county's own community input process regarding the jail and alternatives. It's time to radically reimagine community safety and invest in non-carceral community-driven alternatives that address the systemic inequalities that are the root causes of crime. We need social services, things like housing and addiction treatment that provide real community safety. Thank you so much, and I'll see the rest of my time.
The next speaker is Deborah St Julian. I've unmuted you. Please accept the unmute. You'll have 3 minutes to speak. The timer will start when you begin speaking.
My name is Deborah St Julian. I'm a family nurse practitioner, a member of Showing Up for Racial Justice at Sacred Heart and the Faith Community Urban Sanctuary, San Jose. I have lived in District 1 for 36 years. I consider inadequate access to addiction treatment, mental health care, and housing a public health crisis. We are asking you to honor the findings of the county's own community input process regarding the jail and proven alternatives. The time is now to reimagine community safety and to invest in community requested, effective, non-carceral alternatives, those being adequate housing and community-based access to mental health and addiction services. Jails don't work. Care first, jails last. Please pay attention to your community input process. Thank you.
Next speaker is Karen Matsuda. I'm unmuting you. Please accept the unmute. You'll have 3 minutes to speak. The timer will start when you begin speaking.
Hi, this is Karen Matsuda. I live in Supervisor Chavez's district, and I'm a member of Showing Up for Racial Justice at Sacred Heart and the Care First Coalition. As you prepare for the decision in January regarding a new jail, we continue to urge you to summon the courage and the creativity to honor the findings of your community input process, calling for alternatives to incarceration. A brand new jail would still be a jail, a building that would decay and itself need to be replaced, and yet it would still not result in restoration or community safety. This is a once-in-a-generation opportunity to invest in radical new ways to create true public health and safety for the broader community. We would love to see you make that your legacy. Thank you.
Next speaker is Scott Larkin. I've unmuted you. You'll have 3 minutes. Please go ahead.
Thank you. Good afternoon, everyone. Happy holidays, Scott Larkin. Hopefully you guys can hear me okay. The cell phone reception's a little shaky. Down the street, at the largest homeless encampment in Santa Clara County, basically kind of in the state, the city is cutting off resources to the
We lost
See.
you.
Hey, Scott, your sound is inconsistent.
I think we've lost Scott.
Sorry about that.
Oh, there. Sounds like he's back. Go ahead, try again, Scott.
I think we've lost him. We'll come back to him.
Okay.
in just a moment. We'll try him again. The next speaker is Molly McLeod. I've unmuted you. Please accept the unmute. You'll have 3 minutes to speak. The timer will start when you begin speaking.
Hello, my name is Molly McLeod, and I'm a little bit befuddled at the moment. Fortunately, I can follow along with some of my compadres on the showing up for racial justice and know that this is here. But in terms of the actual meeting, the transcript feature, the captions are not turned on. And so what I wanted to share is about disability justice and about accessibility. So I'm a well-educated white woman who watched my Black son and advocated for him when all was growing up, because from second grade, he was really pushed onto that school to prison pipeline. And I think that this is something that really should be pretty easy by now to do in terms of access. And when I am thinking about the things that community members are doing, like I was so moved to be at the Mexican Heritage Plaza among folks who are providing answers and alternatives to incarceration. For me, one of the issues is the despair people are feeling in this time of the pandemic. And so I've gone to Project Let's National, it's youth led in high schools and colleges. They have these peer support groups for people who feel suicidal. And so it was talking about mutual aid and pod resources. I found out about an app created by a young Black disabled woman and her brother. You could send out a notice of 5 people, friends, when you're just feeling like that's it. There are so many things that we haven't tried yet. And what we know is that the things that we have tried collectively, systemically, institutionally for decades, these investments haven't worked in the sense that we are number one in locking people up. And yet that hasn't made us really be safe in a way that it's on a feeling level. So please continue this really important work on accessibility. It is a daily practice and commitment, and it shows up in the little ways. And then we center those who are most impacted, in other words, systems impacted folks and family members, and those who've experienced generational oppressions, and then work from that lived experience to doing the changes. Thank you so much for your consideration. And I'm using my little tech workarounds to make this work. But it's kind of hard to try and be making a way in this circumstance. Again, thanks for listening.
Next speaker is Verhar. I have unmuted you. Please accept the unmute. You'll have 3 minutes to speak. The timer will start when you begin speaking.
Hi, good afternoon. My name is Verhar. I'm a community organizer with Silicon Valley Debug. I live in District Supervisor Chavez's area. And I just want to say, if there's COVID in the jails right now, and there's folks in there that are actually in the hospital. And I just want to also let you all know that how is a new jail going to help the folks with COVID that are in there right now? I think this needs to be in January. I think there needs to be more time in thinking about this, because there's obviously a lot of alternatives that can happen. And this has been going on for a long time already. And it's just, this is crazy. We're here again, doing this again. And to also honor the findings of the report from the community input sessions. And yeah, that's all I have to say. See you next time.
Next speaker is Jose Valle. I'm unmuting you. Please accept the unmute. You'll have 3 minutes to speak. The timer will start when you begin speaking.
Hey, how you doing? This is Jose Valle. I'm calling to see, there was an email sent out in regards to the family of Alfonso Zavala. The family is looking for some answers, whether that be from Board of Supervisors, jail administration, the coroners, or from Oakland in regards to the recent passing of Alfonso Zavala inside of Elmwood. He was found brain dead, and there's still no answers as to what led to his passing. The other thing is definitely with COVID, health already went ahead and said with 2,000 is the minimum number that would be sufficient in order to treat people and maintain all protocols and policies. I think we need to stick to that number and collaboratively work together with all partners to ensure that we don't get a number bigger than that, and we definitely do not need a new jail. Thank you.
And we'll go back to Scott Larkin. Scott, I've unmuted you. Whenever you're ready, go ahead.
Okay, great. I'll try this again. Hopefully you guys can hear me a little better. I was hoping that some of you could come out to the crash zone to observe what is going on out there right now. The city has cut off resources, and it's pretty shocking what is happening. All of you are going to go on holiday break after this meeting, and we'll come back into January, and it's going to be a really, really bad scene out there. They cleared 2 sections out there, as you guys can see as you drive past it on your way to work, but they shoved everybody into the 3rd section. They didn't do anything to organize the area. And the city's standpoint is, we do not have any authorized sanctioned encampments. We are going to do nothing to maintain the inside of that camp. They could have set up cones. They could have gotten out, like my mom said last night. She said, hey, why don't you just get out some cans of orange spray paint, like they mark areas off? Help people keep their RVs 10 or 15 feet apart, straighten them out, do the same thing with the tents. Go in there with a backhoe and just level out a couple areas that are tore up so people can drive in and out. Everyone is already there. And I understand this is a major problem and we can't have people there, but they are there. And they're going to be there for the next 6 months. Why not just organize what's there? You can better service people. You can help them. Behavioral health can drive in properly in their vans. They can't even do that now. Community service officers can drive through there. The police still drive through there, but it is you got to stick that thing in 4-wheel drive sometimes. Also, we have a problem with a man on the corner of Spring and Heading right there, the woodchucker. And he is now, I believe, on his 4th story. I thought it was 3 stories as of yesterday. So he's built this big meth tower out there. He has now had so much wood dropped off out there. He could put Burning Man to shame up in Nevada. And at my storage center that's across the street, everyone that rents a unit there, every one of their units, everything inside just reeks like plastic and smoke and soot. And nobody's shutting him down. And he's a problem. These are the bad apples out there that make it more difficult for everybody. There was a fire right near the woodchucker the other night, and it could have caught to other motorhomes, and it could have been a ghost ship warehouse incident. I've talked to the fire department. I've talked at multiple meetings. Gail, Sean, Richard, everybody's been banging that drum. You guys can do the right thing and get somebody out there. Just make the calls, send the texts, shut that guy down. It's not okay what he's doing, and people are going to die and they're going to get hurt. So please help.
A request to speak.
Thank you very much. This takes us now to approval of the consent calendar. Supervisor Wasserman, I'd like to add item 6, which is receive quarterly report from custody health relating to COVID-19 protective measures, and item 8, which is to receive the report from the sheriff relating to training and public safety. I'd like to add both of those to the consent calendar. I really appreciate staff for submitting clear, thorough, complete reports. Supervisor Wasserman, do you have any additional changes?
Thank you. No, I think they're all clear, concise reports. If there's any more you want to put on consent, I'm in favor of that. Otherwise, I will approve your motion.
Perfect. Then let's do a roll call vote on the consent calendar, including 6, 8, 13, 14, 15, 16, 17, 18, 19, and 20.
Madam Chair, before we do that, we do have a couple of speakers.
Oh, thanks so much, Dave. Yeah, please.
How long would you like to give them?
2 minutes.
Okay, 1 moment, please, while we get the timer set. First speaker is Jose Valle. I've unmuted you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hi, sorry about that. I'm actually just speaking, advocating for a family member that wanted to go ahead and speak during the earlier public comment, if that's okay. She may have already raised her hand.
What's the name?
Her name is Rebekah.
We do have Rebecca in line next to speak.
Perfect.
Thank you. I appreciate it.
Okay. 1 moment, please. Next speaker is Rebekah Rivera. I've unmuted you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
And Dave, your voice is very muffled.
Oh, my apologies.
Oh, there
Rebecca, you have 2 minutes to speak. Please go ahead. Rebecca, you need to unmute yourself. Looks like Rebecca.
Is this better?
Oh, there you go. Go ahead.
Okay. Hi, I'm basically my name's Rebekah Rivera. I'm speaking on behalf of my brother Alfonso Zabala. He was incarcerated at Elmwood. He did pass away there at the regional hospital. Basically, we've been trying to get information of what happened, what caused his death. No one's been telling us anything at all. So I would like to know like what housing unit he was in and or was classified. What are the initial findings? Who's leading the investigation? Just so us as a family, we can get some type of closure because we just keep getting the runaround with everything. And I just basically want to know what's going on with my brother's death because he was only 25 years old, supposedly died of a heart attack, died of lung, kidney failure. They keep telling us all these different things. So if you guys can try and get back to us so we can get some type of closure on his death. Thank you.
Next speaker is Leslie Ziegler. I've unmuted you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking. Leslie, are you there?
Sorry.
Go ahead.
Hi, I am Leslie Ziegler. I'm a member of Showing Up for Racial Justice at Sacred Heart and the Care First Coalition. I live in Supervisor Simidian's district. And I just want to say that we really want you to honor, and you and the board and the county, all the relevant departments to honor the findings of the county's own community input process regarding the jail and alternatives. And it's really time to radically reimagine community safety. I don't know if people really hear when we say to invest in non-carceral and community-driven alternatives, that means that instead of punishing people, we try to help them rehabilitate. That's really what we're talking about. And we're also talking about addressing systemic inequalities and investing in things that lift people up instead of punishing and harming them further. Thank you. That's what I have.
The next speaker is Catherine Hedges. I've unmuted you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hi, thank you. Yeah, I'm Catherine Hedges, and I'm a surge speaking out for racial justice. And I am also concerned about the recent death in the jail and the conditions, and that we really, really need to have alternatives to incarceration. We shouldn't have police officers showing up to welfare checks and shooting people. We shouldn't have people dying in the jail. We shouldn't have just all kinds of things happening that are happening. And we need to just reimagine the whole system. I'm hearing that even though we have a sobering center, police are arresting people for drunkenness and putting them in jail instead of just taking them to the sobering center. I mean, what's the point of having good programs like that if the police won't even use them? And what's the point of jailing someone for public drunkenness when they just need to go to a sobering center? Thank you.
Next speaker is Scott Larkin. I've unmuted you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking. Scott? Oh, looks like Scott has dropped off the call. That concludes our request to speak.
Thanks so much, Dave. I want to just take a quick second to express my deep, deep condolences to Ms. Rivera and to your entire family on the loss of your brother. That does indeed sound beyond tragic. Received your email, forwarded it on to County Council. The Board of Supervisors generally doesn't have information, and I wonder if someone from County Council now, or if there's another appropriate person, could just explain very briefly what the process is, if it's a brief thing, when there's a death in custody. Whose role is it to connect with the person's loved ones?
Hi, this is Kapitan Ryan from County Council. Can everybody hear me?
Yes, Kavita.
Okay, and I apologize for being off video. I'm actually on vacation this week and not dressed to be on video, but I echo your condolences, Supervisor Ellenberg, and I'll just add by way of process that we did receive the forwarded message from you earlier today. Process-wise, we will ensure that that message is forwarded to Custody Health, to the Sheriff's Office, and any other relevant departments to follow up with the family. One question in sharing information out where there is any health-related considerations or considerations around someone's criminal justice involvement is making sure that information is communicated within the sort of confidentiality and security provisions that we have a responsibility as an organization to make sure are respected. But that, of course, doesn't mean that the family cannot have access to information. So I will make sure to follow up in an offline way that is more protective of your family's privacy and your wishes to get that information to you.
Thank you very much. To the family. It doesn't have to come to me. I appreciate that, Kavita.
Yes. No, I'm sorry. I was speaking to Ms. Rivera.
Perfect. Thank you so much. Dave, let's do a vote now to approve the consent calendar, please.
Vice Chairperson Wasserman?
Yes.
And Chairperson Ellenberg?
Yes.
Thank you.
All right, that takes us to item 4, which is to receive verbal reports from departments on the response to COVID.
Good afternoon, Supervisor Ellenberg. This is Miguel Marquez, and I will be coordinating this item today. And first up, we have Judge Beth McGowan with the Superior Court.
Good afternoon, Supervisor Ellenberg, Supervisor Wasserman. The court is currently in the process of continuing to reopen certain departments, including hopefully our Palo Alto courthouse in April of next year. We are also working with the county to improve our video arraignment program and other things to provide remote access to courts. Currently, our backlog of time not waived COVID cases or cases that were delayed or postponed due to COVID is now at 650 cases, and that completes my report.
Thank you. Supervisor Wasserman, do you have any questions for Judge McGowan?
No, ma'am. Thank you.
Okay, thank you. Let's move on.
Thank you, Supervisor. Next, we have the Sheriff's Office, and I thought I saw Under Sheriff Ken Linder on the line. Or the Sheriff's Office, and yeah, it looks like they're together.
Yep. Good afternoon, Chair Ellenberg and Vice Chair Wasserman and committee. Today we have Sergeant Menchaca to provide a report.
Good afternoon, Supervisors Wasserman and Ellenberg. The Sheriff's Office currently has 2 staff members in isolation with COVID and 5 in quarantine pending test results. Of the staff members in isolation with COVID, both of them are fully vaccinated. Also, there are 5 COVID positive inmates in our care. 3 are vaccinated, 2 are unvaccinated. And as far as our vaccine numbers, to date, 91% of the sheriff's office staff has reported as vaccinated. Of the vaccinated staff, 99% are fully vaccinated and 1% is pending their second dose. Specific to the Custody Bureau, 93% are vaccinated. And of those vaccinated staff, 98 are fully vaccinated and 2 are pending their second dose. This concludes my report. Thank you. And do you have any questions?
Fabulous. Thank you.
I think I heard no questions. Is that correct?
Questions?
Got it. Thank you. Next, we have Custody Health, and I see Dr. Eureka Day on the call.
Yes, good afternoon, Chair Ellenberg and Supervisor Wasserman. This is my report for today. First, I want to extend condolences and sincere condolences to the family and friends of the deceased. It's very unfortunate, and of course, we all feel that pain. We have only 3, and I'll clarify the numbers as of today. We do have 3 confirmed cases of COVID-19 that's in the house right now. We do have 2 patients that are still hospitalized. So we were coming down to 3 from 151 high. We're continuing to be very aggressive, as I mentioned before. As always, we have started our Binex down testing again every day for all staff, to include Custody Bureau, Custody Health, as well as probation. And of course, with the surge that we've had recently and with the vaccination rate of our staff being as high as Sergeant Machaca had mentioned, and 100% for healthcare, we are seeing these breakthrough cases. And so therefore, we're being aggressive, and all staff are having to be vaccinated, having to be tested every day with a rapid antigen test. We'll continue that process until we get through the surge. And of course, with the new variant that's out, and we're not quite sure how that variant is going to behave, we'll continue to be aggressive regardless of our vaccination rate. We have made several changes with some of our protocols and our policies and our basically our activities around COVID to continue to mitigate the outbreaks. We have had the outbreaks of fully vaccinated patients as well as staff. A lot of that is because of the life of these vaccinations. We're learning now that Pfizer and Moderna have a 6-month life. And then, of course, Johnson has a 2-month. And as you all know, we first started out almost exclusively with Johnson vaccinations for our patients. We are offering boosters to all patients, regardless of risk factors and or immune compromised. And so we're also encouraging all boosters shots for our staff. And we're offering clinics for vaccinations and boosters 4 times a week with dedicated nurses for all patients. That concludes my report.
Thanks very much. Dr. Day, I just want to reiterate the direction that I made at the Board of Supervisors meeting for independent review of the COVID protocols in custody setting. Sounds like things are very good right now.
Thank you.
Okay. Miguel, who else do we have?
Yep, next we have Deputy Chief Probation Officer Mike Sims.
Good afternoon, supervisors. I don't have any major updates, but just wanted to fill you in that all of the staff working at the James Ranch and Juvenile Hall are vaccinated. Any providers who are also coming into our facility are also required to be fully vaccinated prior to coming in. We did have 1 staff who tested positive for COVID, but based on the function, no youth were involved or around that exposure, so there's no containment issue there. We are still doing in-person school. That's still in effect, and things are going well in that area. And in terms of our court cases, we currently have no backlog. And that concludes my report.
Is there family visiting allowed right now?
Yes, because all visiting is continuing as we started out several months ago. We are still continuing to move forward.
Great.
Great. Thank you very much.
And our final report is pretrial services, which will report from relating to administrative booking. Matthew Fisk.
Thank you. Grateful to report on behalf of administrative booking and pretrial services. 98% of staff are fully vaccinated, and we're offering all services. There is one limitation: drug testing is limited to really specific court orders and officer discretion. Otherwise, everything else is up and running. Thank you.
Terrific. Thank you so much. Before we move on to item 5, we don't need a vote on this item, but are there any public speakers wishing to speak on item 4?
We have no public speakers on this item, Madam Chair.
All right, then we're moving to item 5, which is to receive a report from the Office of the County Executive relating to video arraignment issues regarding criminal court cases.
Thank you, Supervisor. This is Miguel Marquez. I will be coordinating this item as well. So today I will be providing an update on video arraignment issues regarding criminal court cases. I am pleased to report the topics raised within the referral have been addressed by the relevant criminal justice stakeholders. I want to thank the Sheriff's Office for accommodating jail tours, for working closely with the Public Defender's Office and with other partners on process improvements, and in particular with the Public Defender's Office on the video arraignment list, and everyone else for willing to pilot new things. When we surveyed video arraignment participants, we found that 8 out of 10 participants were either neutral or satisfied with the information they received when deciding whether to participate in a video arraignment. And this is an important point because the information they received informed their decisions on whether to opt into a video arraignment hearing or not. Additionally, 9 of the 10 participants had the opportunity to connect with their deputy public defender before their arraignment hearing. And the 10th person just did not answer the question. So we don't know if it was 10 out of 10 or 9 out of 10, but still pretty good numbers there. The public defender will be conducting a pilot test to ensure the most appropriate individuals are participating in video arraignments, which will inform the creation of the video arraignment list each day. So that's the video arraignment list issue. There have been some issues of audio quality, and those are being addressed by the court's IT department. And I owe a call to Judge Beth McGowan to talk about the county's participation to see if we could support them. It's their facilities, but we should be able to, as a county, because it benefits so many of our county operations, to provide some financial support to make sure that the audio quality is what we need it to be. I can report that there were no reported audio quality issues occurring at the Elmwood Correctional Complex. And I can report that there were no reported video issues either at the courthouse or at Elmwood. I need to let you know that when a correctional deputy recognizes someone will need an interpreter, the individual is sent to court in person. And the only exception to that is if the person is COVID positive, in which case they will stay at the jail for a video arraignment hearing, and an interpreter services will be provided to them when they stay in jail. The Public Defender's Office is considering using its own specific tablets to connect with clients before their arraignment hearing to help address any additional access issues that have been happening. And then finally, on the topic of moving the arraignment calendar from the afternoon at 1:30 to the morning at 8:30, that will require ongoing discussions to fully understand the operational implications across all of the impacted departments. I can report that we've been meeting as a group, and there is consensus among the partners that we of course want to reduce delay, but ultimately it is the court's calendar, so it will be the court's decision on when it chooses to calendar the arraignment calendar. But the county executive's office is happy to convene the partners to continue working on this issue to see if we can come up with resolution. So with that, we have all of the criminal justice agency partners on this call if you have any questions. Thank you.
Thank you so much for the report. I did find it to be largely responsive to the referral that Supervisor Lee made. I have just 3 follow-up questions that I would like to be addressed when this item returns to the Board of Supervisors. They don't necessarily need to be answered right now. I know this report is moving on. First, the report indicates that language access services are made available to individuals, as you just said, Miguel, who are COVID positive and unable to attend arraignment in person. If it's possible to provide the translation services virtually, why don't we do this for all video arraignment participants? And if it's a quick answer, happy to have it now. If it's complicated, it can certainly go in the full report to the board.
Supervisor Ellenberg, I can try to give you a quick answer to that, which is that it is really cumbersome to do translation over Teams while we're in court because there isn't an ability to do simultaneous So it can be done when really necessary, but it's not the ideal situation for interpreters. And so that's why we tend to not use it unless the person cannot be brought to court.
Thanks, Judge Gaffon. It'd be interesting to know if there is technology out there, the way we have the closed captioning and Google Translate is simultaneous.
I believe Zoom has a little better way to do that than Teams, but we're using the Teams platform, and I'm not aware of a way right now for that. But I think they're, according to the people I've been talking to from RRT side, they're working on those issues, but there isn't a solution yet.
If I could add one more comment that I think might be responsive.
Please.
We are in negotiation with our union as well, who has certain demands around what services are provided in person, and those union negotiations are ongoing.
Thank you both, Judge McGowan and Judge Gaffon. I appreciate that the court is working on this. We certainly strive for equity everywhere and providing the same access regardless of an individual's language needs. The board adopted a language policy in 2015, committing to providing equitable services to all residents to ensure that every resident has meaningful access to county services. I recognize that this is a court process and appreciated Miguel Marquez's offer to let us know how the county might assist in remedying this issue. Second, the Office of the Public Defender will be exploring ways to facilitate confidential sidebars with their clients during video arraignments. How is that department seeking to address this concern, and do you have a timeline to pilot a solution?
Good afternoon, Supervisor Ellenberg. I would ask Assistant Public Defender Sarah McCarthy, who's on the call and just showed up in her square, to answer that question.
Fantastic. Hi, Sarah.
Hi there. Yeah, thanks. So we have a few ideas about how we might do this. So one thing that we've considered doing is actually being physically present in the jail with the clients who are on video arraignment. So rather than having our attorneys be on video somewhere else at a different location, we are in the jail space set aside in M8 where they're holding the video arraignment, standing next to the client. So that if we needed to, mute for a second, talk to the client privately, and then unmute and go back on a record with the court, for example, we could do that. Another possibility that we're looking at is using breakout rooms on Teams or Zoom to sort of create a private sidebar as needed. So that could be done with attorney and client. Maybe that's done with attorneys and the court to have a conversation. But that's a second idea that we've been exploring. It's been a little difficult to get the in-person stuff off the ground with what's gone on in the jail recently with the outbreak. But now that we're in a seemingly a pretty good space as far as the recent outbreak goes, we hope over the next few weeks we can start playing around with some of these new ideas and seeing if they're workable.
That's exciting. Thank you for that. My third and final question is that the report indicates that administration will be convening a work group of the district attorney's office and the public defender to explore whether arraignment calendars can be moved to the morning. Do we have a timing for the work group, and where would those findings be reported? Will it be back out to this committee?
Supervisor Ellenberg, I think that's probably a question that Miguel should answer, but we did discuss it at our last meeting. And we did not set a timeline. I do think it's appropriate for it to come back to Public Safety and Justice. It's going to be very tricky to try and figure that out. And as he mentioned, we do need the court's participation if we're able to find a solution. But one of the problems is the short timeline for the DA to charge a case. And, we don't want our clients to stay in custody longer so that we have more time to work the case up. And it might be the case that the DA's had to get up at 3 a.m. to get the charging decision done. And maybe that's not unreasonable. I don't know. But anyway, we will have a conversation about it. We just did not set a timeline.
Okay. Thank you. I appreciate all of that. And it's really gratifying to see so many departments working together on solutions here. Thank you. Supervisor Wasserman, do you have any questions for this illustrious group?
Thank you. Illustrious group is a good word for this this group. I always appreciate the education I receive when I hear from all of you and learn about little nuances and things that seem obvious to me and things that I had no idea were occurring. And I hope, Molly, none of your staff needs to be anywhere at 3:30 in the morning to accommodate something at 8:30 in the morning. I appreciate the courts working with the county. I also appreciate Chair Ellenberg's enthusiasm about the county helping the courts. That's something I always get into with the county helping here and the county helping there. So it is a partnership, and I appreciate all those representing the courts and representing the county being on this committee and helping us make our system better. Thank you, Chair Ellenberg.
Thank you. Do we have any other committee members who want to make a comment?
And Madam Chair, just a question, if I may.
Please.
You mentioned asking the questions here or hearing them at the board. So now that we've heard them here and received the answers here, is your intention to do that again at the board? Or is this
I would like the report to go to the board to include responses to those questions, because I imagine that our colleagues might have the same questions, and we can preempt them by getting that information in.
Okay, good.
Which was the thinking, obviously, to have the report come to us before going to the full board for just those reasons.
Good. And if I may, just what I was going to say is if the answers are going to come back in the report as well, then depending on what else is necessary, this could be an item for consent or an item not for consent. And I appreciate getting all the items today. Thank you.
You got it. Do we have any public speakers on this item?
We have no public speakers on this item, Madam Chair.
Okay, again, we don't need a vote, so we're going to move on to the next item, which is item 6. We added that to consent, which takes us then to item 7, which is to receive a report from the Office of the County Executive relating to our 2022 legislative policies.
Thank you, Supervisor. And I see our Legislative Manager, Danielle Christian, on the call.
Hey, Danielle.
Hello, good afternoon, Supervisors. Danielle Christian, Legislative Manager. What you have before you today is a proposed chapter to the county's legislative policies document related to the Public Safety and Justice chapter. You will recall that each year, although we didn't last year because of the pandemic, we meet with county departments to solicit updates to the document, ask for things that might be on the horizon in the legislative space, and delete items that are obsolete and add new information that should be in there. The purpose of the document is for intergovernmental relations to be able to engage quickly, which makes our engagement more relevant on bills that match up with statements that are inside the document. Sometimes issues come up that are not covered by the document, or sometimes issues come up that are a little bit more complicated. While there may be some information in the document that would allow us to engage, we may decide that the issue would benefit from public review by a board policy committee and then the board before engaging. And in those cases, we conduct an analysis and bring it to the policy committee and then to the board for authorization to engage with a recommended position. I did see that there are some suggestions from Supervisor Ellenberg or from Chairperson Ellenberg to add to the document. Happy to do that. I'm also happy to answer any questions that either of you may have.
Thanks so much, Danielle. And as you noted, attached to the report is a supplemental item with my requested language changes. These aren't, they aren't substantive, but they are, I hope, clarifying. I did have one question that I did want to ask, though. On page 5, under the Department of Correction, 1A supports clarification from the state that good conduct and work credit should not be given to persons participating in at-home detention. And I don't know who the appropriate person is, but I would love for somebody on the committee to explain why, if a person does not violate the terms of their community monitoring, why wouldn't they be eligible for the same credits as someone in custody?
I can share that this language has been in the document for a very, very long time. It preceded my time in the office, which is also a very, very long time. Which
means I didn't read it carefully enough 2 years ago. Is that what you're saying?
I'm saying the document has a lot of statements that have just kind of prevailed throughout the revisions. We could probably come up with 5 very concise statements that cover everything, and instead the document starts to get a little bit more specific with revisions and incorporating input that's important to the department.
Sure.
So I can share that it's been there for some time. I don't have any history or background as to how it ended up in the document or what the concern was that was expressed. And I would say that statement actually goes back to the time where we had a different structure for managing the Department of Correction than what's in place right now.
So does it make sense to still include that provision?
Unless one of the leaders in the public safety system on the meeting today has an objection, I think we can delete it. I can't recall, and again, I've been doing this for some time, I can't recall engaging on any legislation related to that statement.
Yeah, I would be inclined to strike it, and I'm interested to hear maybe from Matt Fisk.
Yes, nice to see you, Supervisor Ellenberg, Chairperson Ellenberg, and Mr. Wasserman, Vice Chair. It's pretty complicated. There are 3 statutes that regulate credit for time served, and they talk about the restrictiveness of the release, and sometimes it depends on the stage. Is the person in the pretrial stage? There's also electronic monitoring post-conviction. And so I'd like to give you a more informed answer that's clear and easy to understand for the public as well. Be happy to provide that to you at a later date if you'd like.
Terrific. Could you do that at the next PSJC meeting, or? Yeah, I didn't mean to cut you off guard about that. How about through an off-agenda report to the board?
I can do that. I'll include what our voluntary home detention population looks like,
okay,
and how it's grown.
And so is your current recommendation, before we see the full context of the explanation, to leave this provision in the ledge priorities for right now?
I'm not as informed as I'd like to be on that.
Okay, I don't want to push you for an answer then.
No problem.
Danielle, can we, if we don't make a change today, but Matt's analysis and eventual recommendation is that we do make that change, is there any reason why we can't do it later?
No, there's not a reason we can't do it later. And another thing that I could commit is, if there's a bill that matches up with the statement, instead of using the document to engage with the position, provided all of the involved departments have agreement on what that position can be, which is sometimes challenging in the public safety arena.
Sure.
Instead of engaging, we can write an analysis and provide some background and a recommendation to the committee before engaging on something that would match up.
Thank you. Molly, did you want to add something?
I just was going to say the Public Defender's Office is happy to work with Matt to on the off-agenda report to you, because he's right, it's complicated.
Thank you. It ties in well with the other off-agenda report we're just completing right now regarding electronic monitoring and alternatives. So I think that the data that we have from that will support a better understanding of your question for today.
Fantastic. Thank you. I really appreciate all 3 of your departments, Danielle, Matt, and Molly. Thank you very much. Supervisor Wasserman, I think I had, let me see. No, that was the only comment I had, only question on this item. Do you have any questions?
No, ma'am. No questions, and no members from the public.
All right. Thank you for checking. If we have no members of the public, we will move on to item 8, which we did add to consent. So we can speed along to item 9, which is to receive a report from the Behavioral Health Department relating to the implementation of a behavioral health screening tool.
Good afternoon, Chair Ellenberg and Supervisor Wasserman, Sherry Terrell with our Behavioral Health Services Department. We have Gabby Olivares, our Division Director with our Criminal Justice Services, who will be presenting on the item today.
Fantastic.
Good afternoon, Supervisor Ellenberg and Wasserman and committee members. I'm going to ask that staff help us to cue the PowerPoint. Thank you. So good afternoon again. I'm the Division Director for Criminal Justice Systems, and I'm here to just do a brief PowerPoint presentation on the implementation of our brief jail mental health screening tool that was selected in October. Next, thank you. The agenda that we'll be covering today are statistics from the Council on State Government. The partners and I participated in 4 innovative sessions where there was a lot of discussion just about the population and what tools work best with justice involved individuals. We will be sharing what the tool is, which is the brief jail mental health screen and what it looks like, the benefit of utilization, and trainings and meetings that we've scheduled and conducted with many of our partners as we've launched the tool. Next slide, please. So as I stated, the partners and I did participate in training with the Council of State Government. And so through those 4 sessions, there were some statistics that were shared that I thought would be helpful to share here today, which I thought were alarming. So the first thing is that there's an overrepresentation of individuals with severe mental illness in the justice system, which is no surprise to any of us today. But what may be a bit more surprising is that 2 million people with SMI, severe mental health disorders, are booked into the jail every year. 15% of those individuals are males that are booked into the jails. 30% are females that are suffering from mental illness and are booked into our jails. And people with severe mental health conditions stay in the jail longer than others. There's fewer resources. They are less likely to make bail because of poverty and many other factors that compound this population. And also there is a rising number of individuals, which we call the track 2, which are categorized as deemed incompetent to stand trial. More of those individuals, instead of accessing department state hospitals, they're accessing our jails. Next slide, please. So the tool that was selected in concert with participation from pretrial, probation, Office of the Sheriffs, Adult Custody and Health was the brief jail mental health screen. We implemented it in October. And what our commitment as a department is to provide ongoing trainings to our justice partners. We've done several trainings, whether they receive new staff or there are other partners that would like to come to the table. Behavioral health has committed to training these individuals and their workforce. Also, the tool is also recommended by the Research Development Associate, who did an overview of our system of care a couple of years ago. Also, the Council on State Government is recommending this tool. And lastly, the Department of State Hospitals is now also recommending this tool. The tool, it was really selected mainly by our partners. Our partners really stated that they wanted to have something that was easy to use, that could be done without interruption in 3 minutes. There are only 8 questions. And what we've done to reduce redundancy is we've actually embedded the screening tool in our existing criminal justice referral form so that the partners don't have to fill out 2 different forms, but it's embedded in one. Next slide, please. And here, I just wanted to share with you what those screening questions look like. And again, what is very useful is that a non-clinician can actually administer the tool. So I'm not going to read all the questions, but one question that I just want to read is number 5, do you currently feel like you have to talk or move more slowly than you usually do? So, you know, when someone is experiencing mental health hallucinations or commanding voices, there is always a preoccupation. So, you know, as a non-clinician, you may not know that, but we asked this question just to get a gauge of what may be going on with the consumer. Once we receive this information, we're able to check HealthLink, which is the health record that's used in custody, and also Avatar and Unicare, which are the 3 systems that we're toggling through. And so once this is completed, it's uploaded into our criminal justice referral form. And our mailbox is checked every day to see if there's been any new referrals. Next slide, please. So the benefits of utilization of this tool, it's validated, it's effective as screening tool supporting early identification of individuals that may need behavioral health services. So I think the other thing that we really want to highlight is we're trying to cast a wider net. Before, the only people that we're seeing were people that were sent to us through our collaborative courts. But now, if someone is booked into the jail and an officer, someone from adult custody health really feels that someone is going to be released soon and would really benefit from our services, this screening can be done and sent to us immediately for connection. This also documents why a mental health evaluation is necessary and whether an individual was referred or not. So again, like I stated, we toggle through 3 systems so we can see, was this already someone that we've worked with before, or is this someone that needs a clinical intervention and we should intervene and provide care? Also, it's a structured decision-making results in a timely treatment and connection for individuals. So we don't want people to go further into our criminal justice system. We want to make those timely interventions as soon as possible to connect people prior to discharge. Also, it's an informed decision-making to improve cross-system collaboration and communication to support community reintegration. So, we're really hoping to have more communication with our justice partners about the different populations that they're serving and how behavioral health can have better coordination of care, even if somebody is not in the jail, but maybe somebody just newly came on their caseload and they suspect could have mental health or substance abuse conditions. This really helps to communicate with our partners. And also what we've seen since the implementation is there's been an increase of referrals, which we weren't getting many referrals prior to the implementation. So I think this is just a win for us, just the fact that people are getting to know us, getting to know our services and sending us referrals. Next slide, please. And here I just wanted to show everybody the different meetings and trainings that we've conducted already with many of our partners. So our first training was with Custody Health Services. Also, we have a huge provider network where we bring our substance and our mental health providers together. We conducted a training from them. So also if we have, clients that are part of just maybe the substance abuse side of the house, and we're really feeling that they need connection to additional behavioral health services, we're extending this to our partners as well. Also, we did a really comprehensive training for pretrial on October 13th with 27 participants. So we're grateful that leadership showed up too. Probation staff meeting, we actually had 76 people that showed up to that session. So that was well attended. We've also had one session with the public defender's office with their social work unit. So again, if they have clients that need connection or they suspect, we're happy to receive those referrals. The sheriff's office, the rehab counselors, we also conducted a training on November 5th with them, 14 participants, and we will continue to have more trainings with Custody Health. We're going to their all staff meeting, or actually we have gone to their all staff meeting on November 16th and 17th. And we also had a training with the California Department of Corrections state parole. Next slide. And that concludes my presentation. Thank you for your time today.
Thank you so much, Gabby and Sherry. I really want to congratulate the department for launching this tool in October. There's only been a month worth of data so far, but it really does appear promising. One thing that wasn't immediately apparent in the report was which justice partners have already begun utilizing the tool. I'm so glad to see the increase in referrals, but do you know which departments they've been sent from and who's already using it?
Yeah, thank you. That's a great question. Probation and pretrial. And
so all 15?
All in custody health.
Oh, okay.
Yeah.
Great, thank you. When you do further updates for us, it would be interesting to see the breakdown from departments as more begin to utilize it.
yes, we will do that.
Thank you. Supervisor Wasserman, any comments or questions?
Thank you, Madam Chair. Gabby, those 8 questions, I read each of them and I thought I knew what direction they were going in, and then they very diverse, very different questions. What do you think of those questions?
I think it's a nice conversation and starting piece if you're not a clinician. And a lot of questions that we get from our partners is like, I just know that something's wrong, but I don't know what, and I don't know what to ask. So it kind of just helps to frame that conversation if you're not a clinician. I think for people that are in the field, we kind of take that for granted. I think we immediately, well, what medications are they having symptoms? What happened today? What's the presenting problem? And people are like, whoa. And I think one thing that our partners really stated to us clearly, this has to be easy or we're not going to use it.
Right.
So we're really grateful that, the department's allowed their staff to participate in 4 sessions, but we really felt that it had to be something that we could all own and really commit to using. Because prior to this, we weren't really getting any referrals, and a lot of the foot traffic stopped at the reentry once COVID hit. So we're really looking at other innovative ways to cast a wider net and also to reach those populations. And we have been in discussion also with the sheriff's office about providing more substance abuse services in the jail once there's more access and COVID is better controlled.
Got it. Thank you very much. That's it for me, Madam Chair.
Thank you. Any other committee members want to weigh in or ask questions? Do we have any members of the public?
We do not, Madam Chair.
All right, then we are on item 10 right now, which is to receive a report from the sheriff relating to the quarterly inmate grievances.
Good afternoon, Supervisor Washington, Supervisor Ellenberg. This is Assistant Sheriff David Sepulveda. Today, for our presentation, we have Captain Michelle Asbin and Lieutenant Joseph Nguyen. And we also have Program Manager 2, Laura McCabe, who will be presenting on our survey.
Good afternoon, supervisors and committee members. All associate reports have been submitted and I'm ready for questions.
Supervisor Wasserman, do you want to take this one first?
I'm just checking my list on 10. And no, I have nothing. I have nothing at this time.
Okay, I just wanted to note that quite a sort of question or concern around protecting respondent confidentiality. Are there other mechanisms that we might use to ensure that people are only responding to surveys once, that isn't their inmate booking or housing unit number? Is that too identifiable?
So the booking number is being used so that we don't, that's the identifying information to check off whether they're using it more than once, but it's not used as part of the survey. It simply goes into the list. We just make sure it's not a duplicate, and then we cut off that data and use only the respondent data as for the analysis itself.
Oh, interesting. Thank you. I appreciate that. And I look forward to reviewing the survey results and the parallel analysis that will be conducted by OCLEM. Thank you.
Thank you.
Any other comments or questions from committee members? Any speakers from the public?
We do have a public speaker on this item, Madam Chair.
All right, let's do 2 minutes, please.
All right, one moment, please. Next speaker is Ron Hansen. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Thank you. Hello, supervisors and committee members. I am Ron Hansen, affiliated with PACT, People Acting in Community Together. We are pleased that the Sheriff's Office will be conducting an inmate satisfaction survey that focuses on the inmate grievance process. Because surveys can be important and useful tools for system assessment and improvement, they must therefore be carefully constructed, administered, and analyzed. On the other hand, if poorly constructed or not thoughtfully administered, the survey results will not provide a true representation of what is being measured, nor will they provide good guidance for system improvement. The best surveys are anonymous, are easily and unambiguously understood, are brief and to the point, and provide results that can be used to guide positive system change. Unfortunately, in this case, anonymity seems as defeated by requiring the survey taker's booking number and unit. While it's important to prevent multiple responses from biasing the results, it's equally important to ensure that the means employed to prevent multiple responses does not in itself introduce a bias. Justified or not, some inmates are afraid of retribution from staff. The need to provide this identifying information will likely discourage some of those from participating. Further, if objectivity is truly the goal, an organization must not develop, administer, or analyze its own survey. By doing so, its results will always be in question or will be viewed with suspicion. At minimum, having an independent third party administer the survey and then analyze its data could eliminate this innate fear or perception of bias. Appropriate third parties could be OCLIM, CCLIM, Office of Mediation and Ombud Services, or Office of Women's Policy, the Jail Monitoring Program. We urge the Sheriff's Office to reconsider, and we look forward with interest to the survey results. Thank you very much.
And that concludes our request to speak.
Thank you very much. We are having parallel reviews, correct, from OCLIM as well as the Office of the Sheriff?
Correct. Our plan was to provide the data set to Oakland for them per your request in October to provide it to Oakland and to do a parallel review.
Great. Okay, look forward to that. Thank you again.
Thank you.
Item 11 is to receive a report from the Office of the County Executive relating to nutritional content of inmate meals in the inmate jail survey.
Yes, thank you, Supervisor. This is Deputy County Executive Martha Wapensky. This is just going to be a brief verbal status report on this referral from Supervisor Wasserman. It was back in September of 2019 that PSGC received a report on the nutritional content of inmate meals and a jail survey in response to a conversation at the June 2019 budget hearings. So at that time, Supervisor Wasserman requested the results of the nutrition survey of incarcerated individuals to be compared to other jail facilities. We wanted to let the committee know we have not conducted the survey yet, but we will be doing it in calendar year 2022 and reporting back to this committee. This was due to operational challenges from the pandemic and also problems with the global supply chain. And we do plan to do the survey once normal meal service has resumed. I'm just want to explain a couple of the challenges that food services is experiencing and take any questions you might have. So food services continues to meet the Title 15 statutory nutritional guidelines and the requirement. The two challenges that food services has faced during the pandemic is supply chain and also staffing. The staff have been working closely with the county's procurement department to try to manage cost increases and supply chain shortages, and they're monitoring the situation, have been monitoring closely since the pandemic began. Also, supply chain shortages have hampered the ability to repair and replace the aging equipment that's needed to prepare and serve meals. In terms of the staffing, we've faced significant staff turnover in key leadership positions and vacancies in the line staff positions. The kitchen relies also on incarcerated individuals to serve as kitchen workers to help with meal composition and service. And obviously, the number of available workers has fluctuated greatly over the pandemic and stopped completely several times since January of 2020. The good news on the horizon is we've hired a new food services director. They're currently finishing up the background process and should begin in early 2022. The new food director is going to be focusing on developing an equipment replacement plan, evaluating staffing needed for the consistent meal service delivery, and identifying any food and meal providers to increase the variety of meal offerings. So as I said, we'll be coming back to you during calendar year 2022 with the further report on the survey. And with that, I'll take questions.
Thanks, Martha. Supervisor Wasserman.
Thank you. I'm sorry, Martha, that it's such a complicated thing. When I first brought it up, I thought the ability would be to call a few other jails that we have relationships with, get an idea of where their satisfaction or dissatisfaction was as far as food programs and nutrition. I did joke before when I originally saw, I was on this board when Supervisor Yeager put through what resulted in the menu at the jails at the time, and all healthy stuff. And like I said, I wouldn't be surprised if the general feeling was one of not liking the food. I personally wouldn't be crazy about all the food on the list, but I was interested to see how other jails. And I would like to hear back from you and your department answering that question as soon as you're able to get those answers. I appreciate everything else going on, food supply, the problems in the ports, the COVID, the everything else. But again, Martha, all I thought it was going to be was a few phone calls. I didn't have any idea it would require such an effort.
Certainly, we can do that for you, Supervisor.
Do we have any public comments on this item?
We have no hands raised, Madam Chair.
All right, then item 12 is announcements. I have none. Do any committee members have announcements that they would like to make? If not, having approved the calendar of meetings for the new year on the consent calendar, we are adjourned to January 13th, 2022 at 10 a.m.
Oh, oh, oh. Happy
Happy
holidays.
holidays, Happy New Year. Be safe and be well, everyone.
Hanukkah.
Recording stopped.